Hi, Dr. Nathan Kartchner here. I'm making this video on behalf of my clinic here in Cedar City where we provide ketamine infusions for mental health and chronic pain. So you pull up to Township Square at 110 West, 1325 North. We are the building on the right or the east, and Suite 150. See our name on the marquee, Cedar City Mental Health and Wellness. Okay, walking down, you'll see Suite 150 is on the left. That's where you'll check in. Where we do the treatments is here on the right. You can see the name on the door, Ketamine Cedar City. But first you're going to come in to the left here, check in with our front desk. It'll look like Nikki's sitting at the front desk.
Hi.
So after checking in, you'll go next door. And Craig, our therapist, is manning our desk. And you'll see we have a few different treatment rooms. This is one. But there are more private treatment rooms back towards the back. There's one, and then here's the other private treatment room. You can see there's a nice comfortable chair. We have our monitor, our IV pump. Sometimes we'll turn on the TV to play some calming nature scenes or whatever your preference is. And we'll set you up with a call light. Some people prefer to have eye shades. Some people prefer to have their own headphones. We have blankets so you can stay warm and comfortable. And doing ketamine assisted psychotherapy, our therapist will sit in the room with you. You can have family members sit in the room with you. This is the office. Ketamine is a medication that's been used for a long time, since the 1960s, in fact, in putting to people to sleep for surgery. It's a dissociative anesthetic. Dissociate means that somebody feels like they're out of body, and anesthetic means, taking away pain. I'm an emergency physician by training, and much of my education and training has been around giving this medication safely in the hospital. We'll give it a lot of times for people before we have to do some painful procedure, or put in a breathing tube. There's a lot of utility for using ketamine in the emergency department. However, that's not why I'm here talking to you about it today. I would like to talk about it in its relation to mental health. We've been using ketamine for a long time for sedation in the hospital, and surgeries, and lots of other indications. But in the last couple of decades, we've been using it more and more for patients with mental health issues. We found in the studies that have been done have found that ketamine infusion treatments can be extremely beneficial for patients suffering from depression and anxiety. There's lots of other indications to use ketamine for mental health as well. Substance use disorder, some studies suggest PTSD, eating disorders. I think that in the future, anybody who wants their therapy to be more effective will be using ketamine, could use ketamine in conjunction with their therapy. So that having been said, let me tell you a little bit about what ketamine is and what it does. While we can name clearly the neuroreceptors in the brain, we can't clearly say why ketamine is beneficial for those suffering from depression. I can tell you that it works on NMDA receptors. I can tell you that it causes this dissociative state, and I can even describe to you what that feels like. But modern medicine just isn't capable of clearly explaining the problem is X, and that we give you this medication, and the benefit is Y. But the studies that have been done have been super promising. One study in particular showed that 70% of people who underwent ketamine infusion therapy saw improvement of their depressive symptoms. That means that 30% of those people did not see improvement. So this isn't a magic cure by any means. But for those who have tried lots of other medications, who have tried therapy, it can be a super beneficial treatment option. There are a few things that would preclude you from using ketamine for mental health. Ketamine raises people's blood pressure very slightly. We think that if you're able to exercise moderately, and your heart is healthy enough for moderate exercise, that ketamine is safe to give to you despite that mild increase in blood pressure and heart rate that we'll see. The biggest and most common side effect that we see when giving it intravenously is nausea. Fortunately, here in our clinic, we have multiple medications we can give you through your IV to help prevent any nausea during your treatments and help you be much more comfortable during the treatments. Sometimes people have intense anxiety or just this overwhelming feeling of helplessness. And there's medications that we can offer as well to help lessen that sensation. True. I always give the analogy like when you go to the hospital for a cut in your arm. The doctor's not actually healing that laceration. All the doctor is doing is cleaning it out and then sewing the wound edges together and eliminating any barriers for the body to heal itself. And that's oftentimes the analogy for ketamine and psychedelics when we're talking about mental health injuries and illnesses. If you imagine a new snow-covered slope where kids go sledding down, after a while they form these ruts in the slope where no matter where you start at the top of the hill, you're going to fall into some of these ruts and you're going to be in the rut until the bottom of the hill. So when we talk about our depressive thoughts or anxiety thoughts, it's like starting out at the top of this hill and we fall into these depressive thoughts, these ruts. Ketamine is like a new blanket of snow falling down on the hill, and then you're free to form your ruts wherever you'd like on that hill. One reason that we think that therapy is so important for ketamine treatments is because when you're working with a professional therapist, they're able to help you form those ruts in less pathologic ways. So your therapist can work with you to talk about how to have less pathologic thinking processes. And ketamine is simply a tool to help you and your therapist to build those less destructive thought patterns. For that reason, we think it's almost essential for people to participate in therapy while they're getting ketamine treatments. We have our clinical social worker when you come in for an intake, and then we also ask that you do integration sessions when you're undergoing these ketamine treatments. Typically what we'll do, say for a patient suffering from treatment-resistant depression, is give them 6 IV treatments over the course of 3 to 4 weeks. Typically we do 2 treatments a week for 4 times, and then for dose 5 and 6, we do it every week. And then typically people that find benefit with this medication will come back once a month or so. At that point, it's up to the patient's discretion on when they feel like the medicine has been less effective and they come back for a repeat treatment. For most people, that's anywhere from 3 weeks to 6 weeks at a time. If you have a therapist that you've been seeing for a long time, we ask you to continue to see that therapist throughout this process. And if you get to a point where you don't need the ketamine, it's better to stop the ketamine and continue with your therapy, because a therapist can be so beneficial in helping you, reform those thought patterns that have previously given you distress. There's another super beneficial service that we offer in our clinic, and it's ketamine-assisted psychotherapy. So oftentimes people don't have a diagnosed treatment-resistant depression or generalized anxiety, but they have previous trauma that they've dealt with that they're trying to work through. And so we'll have you meet with our therapist and talk with our therapist as you're receiving a ketamine infusion if we feel like you're a good candidate for that treatment. So what can you expect on the day of treatment? Well, when you come into our clinic, we ask that you give us at least 90 minutes. The infusions itself typically go for 40 minutes, but you've got to come in and greet the receptionist and come and get your IV started, and then we need to talk a little bit, and then we can start your infusion. And oftentimes people will take 10 or 20 minutes in order to wake up enough from the medication where they can walk out of the clinic. So for that entire process, typically is 90 minutes, but we ask you to schedule 2 hours in the day to fully give yourself an unrushed experience. Afterwards, you're not able to drive for 12 hours or obviously operate any machinery because it can make you very sleepy and disoriented. For some patients, it's up to 24 hours when they're having that sensation. It's really beneficial for you to avoid negative experiences. Especially we recommend that people stay off social media, people not watch the news or read anything on the news. Before and after your treatments, it's important that you come with a real positive mindset, and so you can have the best treatment possible. In all psychedelic treatments, what's commonly referred to as set and setting, meaning that we want the setting where you're at to be very beautiful and calm, but we also want you to come in with expectations and with a predefined mindset of you're here for healing, you're here for peace. A lot of patients find it's really beneficial to journal after their ketamine treatments. A lot of times they'll have things come to the front of their mind that they want to remember and that they thought was profound. One of the things that we try to help patients work towards is what the medical literature calls a mystical experience. A lot of people will refer to that as like a spiritual experience. A lot of people try to describe it like they felt like they had exited their body, or there's lots of different ways that people can describe how they feel during that experience. But that's what we're trying to get you to, is that mystical experience. And most of the time people are going to have notice the benefit after having that mystical experience. So taking time to journal and write and reflect about the experience that you had is critical. And that's just another reason why we think the integration sessions with our therapist is so important, is because our therapist can help walk you through the emotions and feelings that you had during the treatments and help you process that and help you decide on ways to best apply that to your life so you can go forward through your life with less severe symptoms.